The MediShield Life scheme bill was recently tabled in Parliament. Now, the bill sets out the legislative framework for the implementation and the administration of this universal health insurance scheme when it kicks in at the end of this year. It's all to ensure better protection for all Singaporeans and permanent residents for life against large hospital bills.
Now, a framework has also been set out to recover outstanding premiums from policyholders who don't pay their premiums promptly. Penalties of up to 17% will be imposed on outstanding premiums, including any interest on late premiums.
Now, to enable the extension of premium subsidies to the lower and middle income households, also to identify those with pre-existing conditions, the bill will also allow the CPF board or the health ministry to access policyholders' financial and medical information in all government databases.
Now, 938 Live and the Government Feedback Unit REACH recently held a dialogue session involving Senior Minister of State for Health and Manpower, Dr. Khor, who is also the chairman of REACH, and several members of the public.
They were great. They asked very relevant questions and also gave some suggestions. Grace Morgan joined us, Morni bin Sulaiman, Stephen Lee, and Sean Kong. Now, the session was held at the Professor Braun Cafe at Boat Quay late last week. Many thanks to the team at Professor Braun as well for having us. So we discussed various aspects of the scheme and the bill that was introduced in Parliament as well. Foremost on participants' minds was the affordability of premiums and how the government would help Singaporeans and PRs in terms of payments. Now, the government has pledged $4 billion over 5 years to help when it comes to premium payments. For most of us, the higher premiums will be fully covered by MediSave. Dr. Khor kicked off the session with more details.
The government is committed to ensuring that MediShield Life premiums is affordable to all Singaporeans, and we have various ways to help Singaporeans with MediShield Life premiums. As far as the premium subsidies are concerned, there are a number of these. Firstly, the transitional subsidies, which is applicable to all Singaporeans over a 4-year period. So the first year, they will get 80%, and 60%, 40%, and so on. And then it will expire. Only the transitional subsidies will be phased out after 4 years. But the premium subsidies for lower to middle income Singaporeans is a permanent feature. It will remain. And that will actually help up to 2/3 of households. In addition to that, for the pioneers, there will be special pioneer generation subsidies that will be applicable to them for the rest of their lives. And if after applying all these various subsidies, the individual is still unable to pay because of financial difficulty, the government will come in to help with additional premium support. And this additional premium support may cover up to 100% of their MediShield premium. So no one will drop out of coverage simply because of financial difficulty.
Okay, so now that that has been established, let's see what questions you have. Grace.
I guess the main concern for younger people like me would be whether we would have to end up paying the bill for the older generation, given that we have an aging population. So will premiums go up eventually? And if so, how much will they be in future, for instance, 10, 20 years' time?
We have said that premiums will not increase for 5 years after the implementation of the scheme. And in fact, the premiums that are applicable, we have already published the premiums applicable for each age band. What actual premium will be payable by the individual will depend on the premium subsidies applicable to him based on his age band as well as household income status and so on. So actually, if you look at the tables, you can actually get into our website. There's a calculator. You can estimate the premium payable for each individual member in the household. So first of all, government is committed to ensuring that MediShield Life premiums is affordable to all Singaporeans. And I think this commitment will continue to stand. Secondly, premiums will not increase significantly just because of an aging population, that you have more elderly in the population. And that is because MediShield, as well as MediShield Life, when it's implemented, the premiums is actually age-based, which means that the premium is linked to the risk associated with each age band. And I think this is an important point. With an aging population, as you have rightly pointed out, it is important to avoid intergenerational cross-subsidy, where the young will pay for the elderly. So if your premiums is not age-based, then what happens is, of course, the premiums will then increase significantly over time because you will have increasingly more elderly who will have to be supported by a decreasing number of younger policy holders. So this is something we want to avoid, and therefore our MediShield Life premiums is age-based. So it is quite unlike, some other jurisdictions where they have social insurance, and the insurance contributions from the working population, which is based on their payroll tax, is used to fund the insurance payout generally to the elderly as well as to the sick. So I think this is one of the reasons why it's age-based.
Go ahead, Stephen.
Yeah, I just like to follow up on the answer given that it's age-based. Does that mean that the senior people will have to pay a very high premium among themselves? Because they tend to fall sick more easily, right?
The premiums do increase with age. In fact, it is no different from the MediShield premiums now. MediShield premiums also increase with age. So it's based on actuarial principles and underwriting practices. It's age-based, as you have rightly pointed out. As you get older, the probability, the chance that you utilize medical healthcare, get hospitalized, seek medical treatment will be higher, and therefore the premiums are higher. But we are very, very mindful of this. We have got permanent premium subsidies. That's for lower to middle income, right? And again, the premium subsidies, for the permanent premium subsidies for low to middle income, it is based on household income. It's also age-based, actually. There are, in addition, if they are elderly, they are in need, they are unable to afford their premiums, even after, we have applied the permanent premium subsidies, they can apply for additional premium support. So that is really the safety net. So for instance, the Pioneer Generation Package for the very old, where the MediShield Life premiums, or indeed even MediShield premiums, if they are covered, up to 92 now, are much higher, right? Now, to ensure affordability for Pioneer Generation, there is MediSave top-up to help them pay, as well as very significant Pioneer Generation subsidies for the MediShield Life premium. So, in fact, actually, for the Pioneer Generation, those who are aged 80 and above, the combination of MediSave top-up together with the significant Pioneer Generation subsidies will fully cover their MediShield Life premium. And in fact, for the Pioneer Generation, the MediShield Life premium payable is actually lower than the MediShield premium payable now. And that is because of, the significant Pioneer Generation subsidies. So we are mindful, although we need to make it age-based to avoid this issue of intergenerational cross-subsidies, we also need to ensure that it is affordable.
You made the point that it is age-based premium. So as people grow older, the risk increases and therefore the premiums will be higher. Another thing about growing old is that your earning power also decreases. So the likelihood of more and more people being on subsidy is going to increase. And when you say that the government bears the bulk of the cost, I think in the long run, is that really sustainable when you have a predictably aging population? I think the government can do so much. And in the long run, what does it really mean for the average Singaporean?
Ultimately, when we talk about government's money, we're talking about taxpayers' money as well. And that too might be compromised as a result of an aging population. Dr. Khor?
Let me first say that in designing the MediShield Life scheme, the MediShield Life Review Committee has also recommended that we should allow the younger cohorts, working age population, to pay slightly higher premiums whilst they are in their working age, so that these will become premium rebates as they get older to offset part of the higher premiums that actually they have to pay when they get older. So that means to kind of level the gradient a bit. That will help for future cohorts, that even as they age and therefore the premiums increase, it will be not as high as if there was no payment of premiums ahead. Of course, at the end of the day, we have also, in addition to making sure that MediShield Life premiums are affordable and payable, is for the working population now, from this year, there is an additional 1% employers' MediSave contribution. And that actually also helps in terms of affordability for the present cohort as well as future, because you built up your MediSave balances, which can be used to pay for MediShield Life. We are also putting in place various other measures. There are features also in the MediShield Life scheme that try and prevent over-consumption as well as over-treatment in terms of having the deductibles, the co-insurance, so there's still some co-payment. And because you need to pay some either through MediSave or out of pocket, Yeah, I think that will also help in terms of capping charges as well as in terms of, the tendency to try and overconsume or doctors trying to overtreat. In addition to that, clinical protocols and guidelines in our public healthcare institutions to ensure that doctors will treat using clinically effective, cost-effective drugs and treatment. There is a standard drug list, so drug advisory committee will decide, based on expert views as well as inputs on what drugs to put into the subsidized list, the medication assistance funds list. There's also a health assessment technology committee, which will evaluate, new technology, medical devices and implants and see whether they are effective clinically as well as whether they are cost effective. And that again is to help contain costs. Then of course we are looking at more transparency of information, education as well as in terms of putting up the tables, of the different procedures and the cost, so you can actually do a comparison, more informed decision making by the patients. Having said all this, fundamentally we need to keep ourselves healthy. Then I think we can manage and reduce the healthcare costs to the individual and as a whole.
And that was Senior Minister of State for Health and Manpower, Dr. Amy Khor. She's also chairman of REACH, the government feedback group. Now, in our next segment, the ease of obtaining subsidies. And what does MediShield Life mean for those of us with integrated shield plans? That's coming up in our next segment of Talkback, bringing you excerpts today of a dialogue session we held recently on MediShield Life. Last week, we talked with some members of the public and Senior Minister of State for Health and Manpower, Dr. Amy Khor, who's also chairman of REACH, about the MediShield Life scheme. Recently, Parliament introduced the MediShield Life Bill, which is aimed at administering and legislating the scheme. So we're bringing you excerpts today of that dialogue session on MediShield Life. We held it at Professor Braun Cafe at Boat Quay. Many thanks indeed to the team at Professor Braun for having us. It was great food, great atmosphere as well. Now, the dialogue session involved, as I mentioned earlier, Senior Minister of State for Health and Manpower, Dr. Amy Khor, who's also chairman of REACH, and several members of the public. We also discussed the ease of obtaining subsidies for premium payments for the Universal Health Insurance Scheme when it kicks in at the end of this year.
Our intention really for extending MediShield Life premium subsidies to those who are eligible for these subsidies is to actually make this process as simple and as hassle-free as possible. So in fact, if you look at the MediShield Life scheme bill that we have introduced in Parliament on the 19th of January, one of the provisions is really for the authorized administrators of the scheme to be able to assess the financial and medical information from existing government and administrative websites. So for these authorized persons, they will be able to access this information only for the purpose of administrating the scheme, as well as to check and compute the eligibility for MediShield Life premium subsidies. And the information that they can access would be like the residential addresses, the annual value of the residents, as well as financial information like income. So what we are talking about, and I need to clarify this because I think there are also some concerns about privacy, about assessing financial and medical information, is that the information that we are assessing is really information that is already on existing government databases held by other government agencies, apart from what we have at MOH and CPF. This is really not new information. And this is certainly not information, for instance, about the bank account of Singaporeans and how much they have. Because we don't have power to get this information, and we also don't need this information. Right? We're just getting information that is already in existing government database. Medical information as well as financial information is really to try and make sure it's simple and hassle-free, as well as to ensure more comprehensive coverage of the subsidies, that as many people who qualify for the subsidies as possible will benefit from it. We are not requiring explicit application. If we require an application to apply for the subsidies, then what might happen is, especially the vulnerable, the needy and elderly, they may not come forward to apply, and then they don't benefit from the subsidies. So we want to try and make sure it's hassle-free, simple, comprehensive, and that's why we are doing this.
I understand that the ministry, of course, will not need permission for this, but if a person finds this sort of deep dive intrusive, they can forbid you to do such checks on their financial and health records. What are the drawbacks to opting out, though?
If they don't allow us to access the financial information, then we will not be able to determine, and compute their eligibility for the MediShield Life premium subsidies and what the quantum is. And that means that they cannot benefit from the subsidies. But of course, they can actually submit an application manually to apply for the premium subsidies.
Based on the booklet that I have with me, which was published by the Ministry of Health, it was explained that the MediShield Life will take care of the current basic MediShield portion of the integrated shield plan. I would like to share my experience for having upgraded to this integrated shield plan. 2 years ago, in 2013, I was diagnosed for lymphoma cancer, and I have to go through 6 sessions of chemotherapy and 17 sessions of radiation therapy besides the surgery that I have to undergo. So now for each sessions of chemotherapy, the bill comes to about 4,500 to 4,700. But based on the basic MediShield payout, they only cover about 2,007. But fortunately, I have upgraded my MediShield Basics to Integrated Shield Plan. Now, with this introduction of MediShield Life, how relevant it is, the Integrated Shield, to people like me?
Thank you very much for that question, sir. Dr. Khor?
Yes, thank you. Indeed, actually, about 2/3, more than 60% of Singaporeans have got an integrated shield plan. The first thing is, many people may not realize that the integrated shield plan actually comprises 2 components. First portion would be the MediShield portion that is actually run by CPF board, and the other portion is the enhanced or top-up portion run by the private insurers. When MediShield Life kicks in, your MediShield portion will automatically convert to MediShield Life, and then the IP portion will remain. With MediShield Life, even those with integrated shield plan will benefit, because if you have an integrated shield plan and say you have pre-existing conditions that is excluded, but with MediShield Life, these pre-existing condition will be covered under the basic MediShield Life plan. With MediShield Life, we have enhanced the benefit, like say better coverage, higher benefits. So even for cancer treatment, the coverage will be increased, claim limits will be increased, and you'll be covered for life. The other thing is, I need to add also that when MediShield Life kicks in, you with an integrated shield plan, you also benefit from the premium subsidies that is applicable for the MediShield Life portion. Now for integrated shield plan, you buy, the premium is higher basically because it's due to the enhanced benefit from the top-up portion, and likely it will be because of higher ward classes. For integrated shield plan, whether you want to continue with it, really depends on a few things. You have to ask yourself, for instance, do I want to be in a better ward, whether it's B1, A, or private hospital? You need to ask if you want to choose your own doctor. Because when you go to subsidized wards in a public hospitals, of course you cannot choose a doctor, but it's team-based care and the standard of care is the same, but you cannot choose. The third thing you need to consider is affordability. Premium affordability over the long term. Because as I've said earlier, premiums are age-based. Even integrated shield plan is the same. And IP premiums are higher than MediShield Life premiums because of the enhanced benefits. So you need to decide if you can continue to afford this plan as you get older. But based on the MediShield Life Reviews Committee's recommendation, we are also working with private insurers on a standard B1 IP plan with standard features that all these private insurers can offer. And so if, let's say, you want to choose your doctor, but you don't need to go to A class, a single room or private hospital, then you could consider taking up a standard B1 IP plan, which will allow you to choose a doctor in a public healthcare institution, or downgrade to that plan. Details will come out later in the year once we finalize the details.
That was Senior Minister of State for Health and Manpower, Dr. Amy Khor, who is also the chairman of REACH, and you were listening to a dialogue session which involved the Senior Minister. In our next segment, we'll be talking about how those with pre-existing conditions will be covered under the scheme. So stay with us right here on 938 Live.
On Talkback today, bringing you excerpts of a dialogue session on MediShield Life that 938 Live and the Government Feedback Unit, REACH, recently held at the Professor Braun Cafe at Boat Quay. Many thanks to that team, by the way, at Professor Braun. They really looked after us very, very well. The dialogue session involved Senior Minister of State for Health and Manpower, Dr. Amy Khor. She's also Chairman of REACH, and several members of the public came as well. We heard from Mr. Morney, Mr. Stephen, also from Grace, and it was a very, very fruitful discussion with an individual by the name of Sean as well. Among the issues discussed, how those with pre-existing conditions will be covered under the scheme. But first, one of the participants, Stephen, had a concern.
Once they are discharged, they are not covered by MediShield Life. So how will they be able to pay for their medical treatment after they have been discharged?
MediShield Life really is to cover Singaporeans, all Singaporeans for life, for large hospitalization bills, basically inpatient bills, as well as cancer treatment and treatment for kidney failure, because over the long term, this can be very costly. So we have decided that, we will include that in MediShield as well as now MediShield Life. But once you are discharged and then you continue to get treatment, either in the community hospitals, nursing homes, or in-home, home care. There are actually other schemes available to help Singaporeans ensure that it's affordable. So, for instance, you can be discharged back at home into the community, and you just need to seek treatment in terms of management of your chronic disease. You can seek treatment at polyclinics, where you can enjoy subsidies, or you can go to a CHAS clinic, CHAS GP clinic, if you have a CHAS card, and you actually get subsidies too, as well as the fact that under the chronic disease management program, you can use your MediSave. In community hospitals, there are also subsidies available for those who qualify. In the ILTC sector, nursing homes, there are also subsidies available up to 80% for between 20 to 80% for those who qualify. Daycare centers, there are also schemes available.
I just have one more question about the cancer treatment. Now, the MediShield Life will cover payment for chemotherapy treatment. But how about scanning and blood tests? Will that be also taken care of?
Yes, if it's cancer treatment, then the scheme will cover cancer treatment, including the necessary scans. There is also a quantum applicable for scans for cancer, and there's a limit which is separate from other scans.
How can individuals find out what exactly is covered and what isn't? Because we have been receiving a lot of questions on that as well.
I think quite a bit of this actually is available on our website. But if in doubt, they can actually approach the hospital staff, right, to get advice, to get the information. If you get to hospital for medical treatment, to be hospitalized, before that, there's actually counseling by a social worker in terms of cost and so on.
Grace?
I understand that people with serious pre-existing conditions have to pay additional premiums of 30% for 10 years. So what kind of conditions will be covered?
Those who need to pay additional premium will be those where they don't have the current MediShield because they couldn't buy. Maybe they got very serious pre-existing conditions they couldn't buy, or because of the age, or they drop out. Or those who have got integrated shield plan but they got pre-existing condition which is excluded. Then they might have to pay additional premium for their pre-existing condition. Now, the reason why I say might is because we are now looking at which are the pre-existing conditions that will warrant payment of additional premium of 30% for 10 years. And we are adopting a more compassionate stance, as in we are looking at those very serious medical conditions where there is a high probability that complications will develop in the future, long-term consequences, and likelihood that they will need to have costly medical treatment or hospitalization over the long term. So for these conditions, additional premium will apply. So even if you have IP and you have pre-existing condition which is excluded now, it doesn't mean that naturally it will be a pre-existing condition where we will apply additional premium. So we are actually looking at this, and we are looking at more of the serious medical conditions. We are working on this, so we don't have a list now. When we are ready, we will provide a broad list of some of these serious medical conditions where additional premium will apply.
Do you foresee it being
Yeah.
a sliding scale that might be applied to those with less serious pre-existing
No,
conditions, or will it be
yeah.
either 30% for 10 years or nothing at all?
Yes, it is actually either 30%, nothing at all. And that's why I say we are adopting a very compassionate stance, right? And we are looking at really very serious medical conditions where likelihood that you will be making claims. Generally, there will be a list of these conditions once it's decided where it will attract additional premium. But then, of course, there could be some cases where, there are grounds for appeal, it may not quite fit in and so on, and we will allow for appeal. I also need to highlight this, that actually for babies who are born after 1st March 2013, in fact, MediShield covers congenital conditions. So therefore, for them, these are not pre-existing conditions. It is only for those born before who had, congenital conditions and so on, and they are not covered. Those will be pre-existing conditions. But whether it attracts additional premium, we are looking into it now.
How about those new citizens and PR who has pre-existing conditions that you are not aware of? Is there a way you can find out whether they actually do have those pre-existing conditions if, let's say, they don't go to our local hospital?
Dr. Khor?
Yes, so indeed, Stephen, it is not easy. It will be quite difficult. They are from different countries. If they seek treatment there, it may not be possible for us to assess the information in the first place, right? We are going to get them to declare their health status at the point of entry. And then when they subsequently make a claim for MediShield Life, when they get hospitalized, at that point in time, we will assess the medical condition and try and determine whether it's a pre-existing condition.
Why not make it compulsory for new citizens or PR who want to participate in the MediShield Life to undergo a medical test? Because the standard of medical tests in their own country may not be as stringent as what we have in Singapore.
I think that there are various considerations. First of all, as I've said, we are trying to make the implementation and the facilitation or extension of MediShield Life premium subsidies, for instance, as simple and as hassle-free as possible. Having them declare their health status is much simpler than requiring everybody to go for a health check, of course. The other thing is actually there is a check, because when they subsequently apply to claim from MediShield Life, at that point we can assess their medical condition, and then we can determine if they actually have pre-existing conditions. Yeah.
So the local doctor at that point that they need medical care will definitely be able
should be able
to shed light on
should be able
their
to
real
shed
conditions.
light, yes.
Stephen, you've got another
I have
question.
one more question. What happened to those who actually get into serious problem by purposely doing something risky? Like, for example, recently we hear that people are actually injecting dye into their eye to make it black or blue or whatever color, and as a result, they have eye infection. Then they may have to go for expensive surgery. So does MediShield Life cover for that kind of thing, or should it be covered for that kind of thing?
Well, first of all, for MediShield now even, there are some standard exclusions. So standard exclusions will be, it will not cover treatment for injuries that you inflicted on yourself. It will also not cover treatment for injuries as a result of attempted suicide. So for these standard exclusions, it will be retained in MediShield Life. There are also like exclusions if it's cosmetic treatment, that will be excluded. But having said that, besides this standard exclusion, treatment for other medical conditions will be covered if they are necessary treatment. Because at the end of the day, it's actually quite difficult to identify and distinguish, which are really the risks that they have exposed themselves to, and as a result, they need medical treatment, and therefore, which one should be covered by MediShield Life, which one should not be covered. I think it's very, very difficult. Because of smoking, they get cancer. Do you cover? What about jaywalking? Then you got accident. Do you cover? There are some standard exclusions, but for others, I think very difficult.
Dr. Khor, I'm not sure whether all the Singaporeans knows about this exclusion. I, for example, didn't know there's such exclusion. So I think one of the message that must go out is that there are exclusion.
I think that's a good point, which brings me to my next point. What exactly is being done in terms of outreach, and what areas do you think need to be a focus of outreach efforts?
Well, I think indeed we need to put in a lot of effort in terms of raising awareness and understanding of MediShield Life. It is not so simple, right? As you have rightly pointed out. So we are looking at various ways to reach out, relying on mass media, on publicity, on brochures that we put at various hotspots, whether it's at the healthcare institutions, the polyclinics, the community centers, having dialogue sessions, which we will be doing again at the community level, leveraging on some of the other stakeholders, including, say, for instance, insurance companies, agents, because people buy integrated shield plans, they can actually educate and advise their clients. At the point of consumption, utilization of medical care, whether it's at the hospitals, SOCs and all that, I think we also need to educate them.
Would you have any suggestions on what else can be done in order to increase awareness about certain aspects of the scheme?
I think especially the grassroots, the MAEC, IAC and the Senior Citizens Club, I think perhaps they can work together with for example, the mosque committees, temple committees, churches committees, to bring the various communities together to come to a community club and listen to the explanations in the various languages.
Very useful suggestion. In fact, actually, this is what we have been doing also for the Pioneer Generation Package. And I think we have learned from the Pioneer Generation Package. We'll adopt many of what works in a Pioneer Generation Package in terms of communication. So, yes, I agree with Moni that we also need to go down to the ground, engage the religious organizations even.
Thanks for the suggestion, Mr. Morni. Anyone else with any suggestions or questions? Grace?
Maybe a suggestion, maybe you could also reach out to employers, because most of us spend a lot of our time at work, and employers are really the ones who supply us with a lot of information.
Good suggestion too.
In our next segment, why the enforcement of premium payments needs to be so stringent. And if you've heard the news, if an individual willfully refuses to pay premiums, even if he or she can afford to do so, the ministry could get their employers to deduct the sum from the salary, or get banks to deduct the amount from that person's account. And people who refuse to pay could be jailed if they try to leave the country. Going to be exploring that issue and more on MediShield Life in our next segment of Talkback, coming up in just a moment. By the way, if you have something to say about it as you're listening to excerpts of this recorded program, just talk to us on Official 938 Live, our Facebook page. Bringing you excerpts today of our dialogue session on MediShield Life that 938 Live and Government Feedback Unit REACH recently held at the Professor Braun Cafe at Boat Quay. Now, the dialogue session involved Senior Minister of State for Health and Manpower, Dr. Amy Khor. She's also chairman of REACH, and several members of the public. Now, among the issues discussed, why the enforcement of premium payments needs to be so stringent in order to ensure the sustainability of the scheme. For instance, if you willfully refuse to pay premiums, even if you can afford to do so, the ministry could get your employers to deduct the sum from your salary, or get banks to deduct the amount from your account. And people who refuse to pay could be jailed if they try to leave the country. But first, one of the participants, Sean, had a question.
Right now, we talk about MediShield Life covering mainly hospitalization-related kind of health conditions, but we know that mental health is also a growing concern, and treatment for mental health, for one, it is taboo, and secondly, it is not cheap. But it affects quality of life and work productivity in general. So would there be considerations to include mental health-related issues in future?
Actually, if you get hospitalized, say, Institute of Mental Health or treatment, you can claim under MediShield Life, It's actually included. The other thing is that actually some of these conditions, right, schizophrenia, depression and so on, is actually included in our chronic disease management program. And they can also utilize MediSave.
I understand that the implementation and the enforcement of payments is going to be very, very stringent. We've all heard about the fact that if you don't pay for your premiums, the ministry could get employers to deduct the sum from a worker's salary, or get banks to do the same thing, deduct the amount from a person's account. People who refuse to pay for the premiums could be jailed if they try to leave the country. Some people have described all of these measures as being draconian. Tell us why enforcement of premium payments needs to be so stringent in the first place.
Yes, Bharati, I'm glad that you actually raised this point, because I think some people, are concerned that would this hit actually the needy, especially the needy and elderly, because they cannot pay. So earlier I already said that actually this group they need not be concerned, that the robust premium recovery process will apply to them, because at the end of the day, they genuinely cannot afford. They will be assisted with additional premium support. In all, we try as much as possible to make premium affordable to Singaporeans. So we have different kind of subsidy schemes and other forms of support, right? In terms of even bearing the bulk of the cost of extending coverage to people with pre-existing conditions. So 75% of the $1.1 billion we estimate for universal coverage will be borne by the government. In addition to that, we are going to be very proactive in trying to help Singaporeans, pay their MediShield Life premium. How? For instance, they can pay their MediShield Life premiums just through their MediSave. Secondly, if they don't have enough, they can use family members. Then we will have multiple reminders and notices to ask them to pay, to give them time to respond or make arrangements to pay. But, despite these multiple notices and reminders, there could be a small group of people, which we call, willful defaulters, who actually have the means to pay but just simply refuse. And therefore, the government has to have the powers to be able to recover these premiums in order to ensure the sustainability of the MediShield Life scheme, in order to ensure that the MediShield Life Fund, is able to meet its commitment to all the other policy holders. So at the end of the day, if there are premium defaults, these will become bad debts in the MediShield Life Fund. Ultimately, the result is everybody else will have to pay higher premiums because of the premium defaulters. And that's the reason why we need to have this. At the end of the day, if you genuinely cannot afford to pay, we will apply the additional premium support to help you with the premiums. If it's genuine, we will not institute the premium recovery process, or we'll waive the penalty, right? But if you are willful and really you have the means to pay, you cannot pay, then I think as part of collective responsibility, inclusive society, and the fact that we do not want to affect everybody else, we will need to then pursue. But it is a last resort.
Senior Minister of State for Health and Manpower, Dr. Amy Khor, she's also chairman of REACH, and several members of the public who joined us at a dialogue session on MediShield Life. Many thanks again to Professor Braun Cafe at Boat Quay for providing a venue for the session. Now, if you are listening in and have questions about MediShield Life, just go to the Health Ministry's website, moh.gov.sg, or talk to us on Facebook, Official 938 Live. We'll help you get some answers.